I'm Dr. Bart Rademaker, and this is the Dr. Guys podcast, Raw and Unfiltered. And if you've been listening to me so far, hopefully you're getting some amazing distinctions and action steps and meeting these amazing people out there that you can reach out to so that you can help yourself, optimize you, because that's what this is all about. Because the truth is that we live in a world with so much information, so many incredible resources out there that, we no longer have an excuse to be sick. And I'm sure that's going to trigger some people. And that's also the purpose of this podcast, is to kind of trigger you into action, not into inaction, not into disdain, but to recognize, yes, there's something that I now can do and have to do if I no longer want to be a victim of whatever condition that I have. And so that's why we call it raw and unfiltered, because we are needing to have the kinds of conversations that you normally don't have, because you don't have the people around you that will do it for you. And certainly the doctors, trying to be really nice with you, don't necessarily have the ability or the bandwidth to be able to have that frank conversation. So that's why we do it here. And so the idea then is that you leave with some distinction or some insight and some action step that you can take to optimize you. So how do we actually do that today? Well, we do that through role playing. And I found that this is a brilliant way to help you understand and recognize that, yeah, this is something that you can relate to. You can see yourself in the role play and recognize, oh, that's my problem, and I'm not alone in that. And so with my amazing guests, one's going to present with a very specific problem, and the other is going to guide them to some form of resolution. Now, let's be fair. We only have about 6 minutes to specifically do that. And so the reality is that, yes, we're going to get some sort of resolution, but it's not necessarily going to be absolutely complete. But that's not the point. It's to give you an idea of what is possible. Now, after that 6 minutes, what we're going to do is we're going to unpack that information and then give you those insights that you may want to have. So I want to welcome today Bryn and Jason, to this podcast. And I'm going to have them each introduce themselves briefly, and then we'll go into the role play. And after that, we'll unpack it. And then, we'll help you figure out what is next. So I'm going to start with Dr. Bryn. Thank you so much for joining me today. Just a brief introduction of yourself, and then we'll go with Jason.
Sure. I'm Dr. Bryn Gillow. I am a correction lifestyle family chiropractor. I practice in the Poconos in Pennsylvania. Been in practice for over 20 years and love it with all my heart.
Awesome. Thank you, Dr. Bryn. Jason?
Yes, hi, my name is Jason Kimura. I am a life coach and wellness coach. I've worked in the mental health field for close to 20 years myself. And so I've converted my clinical practice into coaching now to help people sort of bridge the gap in wellness. I do practice here both in the Poconos as well as online. And I'm excited to be here.
Great. Thank you so much. And so, Jason, I know that you're presenting with a problem. And so rather than just telling what it's going to be, let's go ahead with the role play. We've got about 6 minutes, and I'll give you about a 1 minute warning whenever that's necessary. Go ahead.
Yeah, sounds great. Yeah, so Dr. Gillow, I wanted to kind of bring this problem up that I'm having. I know I've been coming to you for a couple of weeks now, and I came in for some back pain in my mid back area, my lower back, and I'm finding that I'm starting to feel better now, and I'm kind of wondering why you kind of are recommending for me to continue coming on a sort of maintenance process for my back, because I'm just not seeing that I need it at this point. And I'm both presented with like time constraints and financial constraints. I'm kind of wondering what's that about.
Yeah. Well, first of all, Jason, I am so glad that you're feeling so much better. That makes me very happy and excited for you, because that was your goal in coming here, right?
Definitely, yeah.
So, that is the most important part. If you remember from a couple of weeks ago, when we looked at your x-rays, we saw that there was a lot of issues going on in your spine that have been building up for quite some time. Even though this back pain that you were having only presented in the last few months, we had already discussed that back in the past, you had noticed at other times that your back wasn't feeling great. And really the goal here with the care that you're getting is not just for you to feel better right now, but to make sure that your body actually shifts and changes, builds new muscle memory, and just overall shifts into a stronger and healthier position, so that you're not on that edge of, the next thing that you do, next time you go to the gym, or next time you're working many hours in a row in front of the computer, that it flares right back up. We want to make an actual correction versus just making you feel better for a little bit.
Okay.
Does that make sense?
It does, yeah, because I know, like, since I've been seeing you, I'm starting to sleep better. I'm noticing, like, even a change in my digestion. So, like, all these things are working for me, and I'm kind of just, I'm I'm having a hard time kind of seeing the big picture here,
Yeah.
So,
You are not alone in that. A lot of people, once they feel better, modern medicine has kind of trained us in the fact that once we feel better, we stop taking the medication, right?
yeah, for sure.
This here, chiropractic care, as much as people often think it's, just to help alleviate back pain and neck pain, is really more of a change in your system for your nervous system to function better. And when your nervous system functions better, you function better. As you already noticed, other
Yeah.
things change as well, digestion, sleeping, but really the bigger thing is just like when you start going to the gym, and I know you enjoy going to the gym.
Yeah, I do.
If you first start going to the gym and, after a few weeks, you feel like, oh, I got more energy and, I love the way this feels. You wouldn't stop going to the gym at that point, would you?
No, I wouldn't actually.
You want to continue building muscle. You're not as strong and buff as you want to be after a couple of weeks of working out, as where your goal really is.
Yeah, it'd probably actually make me want to go to the gym more often, to be honest with you.
Yeah. And there is so much more to come with the adjustments besides you temporarily right now feeling better. We want to make sure that this is an actual correction for your body, that your body is healthier and stronger, so that when future stresses come up, you actually can continue functioning well and moving well without going into crisis and acute pain again.
So how long do you think something like this would last for me? Like, am I looking at something I need to do forever? Am I looking at something I need to do for a couple of years? Like, how does that sort of work for me?
Well, that is always different from person to person, but going back to your x-rays and your initial findings that we had, to really make a correction in your spine, that process takes 3 months easily to make that initial correction, because it takes a minimum of 4 to 6 weeks of consistent adjustments before muscle memory even has a chance to start changing.
Yeah.
And obviously, after it starts changing, we have to continue building that change.
Okay.
That's why we're sticking with that intensity of the adjustments in the beginning until we've strengthened and stabilized those changes then. And then it is your choice if you want to go into more of a lifestyle and maintenance type of care, where you just make sure that the day-to-day stuff doesn't create any new issues, or if you say, you know what, this is all I wanted out of this.
Okay. I mean, I'm kind of curious too, like if I were to stop, is my body going to kind of go backwards, or does that sort of last, like, in terms of my adjustments?
Yeah, again, this is very similar to going to the gym. If you go to the gym and you build the muscles and get strong and buff, and you are where you want to be, you might not have to continue at that same strong pace as you did in the beginning to get to that place.
Okay.
Would you stop working out at that point?
No, not at all. In
I
fact,
mean,
I've probably changed my strategy or, increase something. So I would have to do something to continue, because you can't just stop working out. You then start to lose muscle mass or, strength or even just appearance in terms of
yeah.
composition.
And that doesn't happen overnight. Same thing with the
Sure.
adjustment. If you, after the initial time, stop getting adjusted, you're not going to see issues immediately. I expect your body to hold and stay strong for a good while, but we don't want to wait for the problems to show back up from day-to-day stress, because you're still going to have stress, right?
Oh, yeah, all the time.
You're still going to have postural stresses. You're still
Yeah,
going to, sit like a croissant when you're on the phone, and
yeah,
overdo it when you're playing with your kids and
sure
roughhousing
do.
the weekend warrior stuff you like to get involved in.
Yep.
So we want to make sure we get rid of that stuff before it causes new problems. Yeah,
Okay.
like brushing your teeth before you have a new toothache.
Right. Okay. Yeah, that makes a lot of sense.
So ideally, you would continue on a lifestyle basis to keep your spine in alignment, to not wait till there's new issues, and to overall let your body function as healthily and as well as it's designed to be.
Hmm.
That's awesome, guys. Thank you so much. That was amazing. That was great. So Jason, first question for you. What was that about for you?
So it's actually interestingly enough because, of course, this was a question that Dr. Bryn presented to me, but it's one I've had of my own health. Um, so her and I have actually talked about this. I've been actually under her care for a long time, and I have a tendency, given my prior history serving in the military, of wanting things pretty quickly. And sort of the way that I was approached towards like health and wellness was go in, see the doc, get what you need, get the heck out of there, and move on. And I've adopted that sort of framework, even post military service in life. And clearly it hasn't served me well. So it was really interesting to because this is so personal for me, you know. I always want things to happen quickly, and the reality is that when things happen quickly, they're either not sustaining or they're not good for you, really. They don't have any value.
Awesome. Dr. Bryn, what was that for you?
It's this scenario is something that shows up for people a lot in my practice, because we live in such a world where, just like Jason said, they want the quick fix, and they don't really want to put that much effort into their own health. So, I will take anybody where they're at, but I always want them to have the best experience with chiropractic, to get the biggest benefit out of what we're doing. So for me, being able to teach people why intensive chiropractic care initially when problems are there and lifestyle chiropractic care are so important and so valuable to their health is something that is just really important in my day-to-day practice.
You see, I think one of the challenges, and I hear this all the time, and you actually mentioned this earlier, Jason, is the financial one. And then oftentimes, doctors, chiropractors, DOs, they're viewed as these people that are uber rich and all they want is to make more money off of you. And then people are questioning, well, is it really necessary? And here's the actual truth in all that. And I think, Dr. Brandon, what you shared, today is absolutely on point. And the truth is that our bodies are designed to be moving all the time, but with all the toxic elements that are surrounding us, our bodies are not enough in motion, and so some dysfunctional dynamics are then created. And here's why this is really important to know for those listeners out there is simply this, is that the way all of our 70 trillion cells are communicating throughout the body is through a very complex network of communication systems, which absolutely and totally rely on a healthy structural body. And that's what the chiropractors take care of. They make sure that structurally you are sound. And if it's not sound, I'm telling you, it's going to cause all sorts of problems. And we know this over thousands of years of the meridians and how those, how those meridians are, we can map those out and how different areas are affecting different organs. And when structurally there's a problem in a certain meridian, guess what? You're going to have a problem in that organ. And so what I recently heard from other chiropractors is that the truth is that you really need adjustment on a weekly basis. I don't care how healthy you are. And that's something that, I've never heard of before. And this is why this podcast is so important for me, is so people can realize and recognize the importance of doing the right thing. Because if you're not doing the right thing, yes, Jason, you're going to go backwards. So I'm going to give the floor to you guys, and what else comes to mind that you want people to know, either you, Jason, or Dr. Bryn, as far as what's going on, what are you seeing? I know, Jason, you're a great coach, so I'm sure you see some health issues. The floor is yours.
Yeah, so I could just kind of start here and kind of say that what I see a lot of times, not just in my practice, but just in other areas of wellness, is that same kind of thing, the need for instant gratification and a quick fix, and not really understanding how complex the human body is and how much effort needs to be placed into your wellness. It really, you have to kind of pay yourself first, more or less, and take care of you first before anything else. And that's, I think, a big piece of this is they see a lot of times, whether it's coming in for coaching, mental health treatment, some kind of physical health treatment, as almost a fix a problem and not necessarily preventative or even maintenance related. And so that's a big thing that I kind of want to put out there, is that these are things that you can utilize both pre, post, and maintain wise for a long time.
Dr.
Yeah.
Brent?
What I want to throw in there too, like you had just said so nicely, Bart, that your spine is your lifeline. That's all there is to it. And if your spine is not in alignment, your life cannot be as exuberant, as full, as healthy, as strong, whatever adjective you want to throw after that. It can't be as much as you want it to be, because it all has to come through your nervous system, and there is no other way. Our body will never go wireless. Everything else in the world is going wireless. Your body will never go wireless. So you need to take care of that. And the most valuable time to take care of it is before it starts going on red alert.
Right.
To start taking care of it in younger years. I mean, I'm a family chiropractor, meaning I take care of children, I take care of newborns, because the birth process in and of itself is already a trauma to the spine when babies are getting pulled by the head out of the birth canal. And it is such a beautiful thing to see children grow up healthy, and yes, can we help with symptomatology, like, ear infections and acid reflux and constipation on babies? Yes. But the more exciting thing is to just see children, adults, all of them to just continue to stay as healthy as possible, fighting colds and infections quicker because their nervous system and their immune system is working harder, and recovering from injury much quicker, and their whole body just working in unison the way it's supposed to. I'll never get tired of watching it every day, of being part of that every day. And my biggest wish for people is to experience this type of well-being in their own bodies.
Spot on. Jason, you want to add some more?
Yeah, I was going to add some more. I wanted to say too, as a patient of Dr. Bryn's, it was one of the most amazing things, because when I first went to her, I shared with her, like, I had seen chiropractic historically as a like hocus pocus kind of thing, as like this voodoo magic. You're going to make me feel good for a couple of minutes, but what's really going to benefit here beyond just kind of having some back pain, go away. And what I found was quite profound experiences. And I remember coming into her office one day and being like, "You're not going to believe this. Like, I'm sleeping. My skin is clearing up. Like, my digestive tract is different. Like, what is happening here?" And I was like, we had this like kind of cool, really neat organic moment together, kind of laughing about some of the just physiological changes that I didn't realize would come in addition to feeling better just from something like coming in routinely and being adjusted. It was really kind of profound for me, and it completely changed my perception about it. And I think I even might have even given her a hard time. So if I did in the beginning, Dr. Bryn, I do apologize.
Okay.
But like I said, I had some skepticism about it, but she has since kind of completely washed that away for me. And I'm a big proponent now of chiropractic because of how much I've personally benefited from going to her and to experience how it's changed my health and wellness overall.
You want to respond to that, Dr. Brent?
Oh, I just love it. It's all good. A lot of people
So,
are very skeptical when they first start, and I'm perfectly fine with that. Bring all your skepticism, ask all your questions, because knowledge is power, and I want people to understand and learn about it so they can see for themselves.
Well, there's a lot of history why, people are looking down upon chiropractors, and full transparency, I was one of those. But I was just indoctrinated, hypnotized, all that stuff. And that stems from the turn of the last century,
Mhm.
when they pretty much tried to eradicate everything that was non-medical. And there was some legitimacy in that, but there was a lot of sort of fallout, if you will, if that's the right word. And a lot of people missed out on that opportunity. And what I love about chiropractors today is not only, now that I understand the relevance of the structural aspect of the body, which is essential for adequate communication, or optimum, communication between ourselves, so that our organs can actually work properly. And there's a lot of scientific basis out there. So if anybody wants to check that out, for sure, look up James Oshman and the work that he's done. But the truth is that I was watching a video the other day of Richard Branson, whatever you think about him, and it was a cute video, because I am not exactly sure how old he is, but he's pretty old. And there he's, just dancing on tables and having a blast. And it's because I'm sure he takes care of himself. And that's exactly, what, Brandon was saying, is that you want to have a quality of life for the rest of your life. And that requires addressing the structural aspect. And it's something that, unfortunately, as MDs and many DOs, I'm sure, have completely almost disqualified as being relevant in people's health. And the
Yeah.
truth is, as in my conversations these days, it's actually the first thing that I address. It's a structural part, including molecular and genetic and some other things. But then the other part that I think is so important and relevant is that, if we want to optimize our health, we really need to look at all the aspects. Because, interesting enough, what I've also discovered through all my work that I'm doing is that if you have a subclinical, tooth infection, it affects your entire body too. And so we definitely have to get the message out there that chiropractic or body adjustments is a very important part. Get it done every week. And then really finding all the different, people that are out there that can support you with nutrition and lifestyle and coaching and mental and all of that, because there's not just one single way of doing things. It's a combination. And I don't even use the word functional and integrated. I mean, we have to look at the complete approach, including coaches and chiropractors and nutritionists and everything else. And that is why I've got this podcast. So I want to give both of you the last word. We'll start with Dr. Brent. Just how do people, find you, and any last and final thoughts?
Life is Good Chiropractic is the name of my office. Easy to find on, just on the web, my website, obviously on Facebook as well. I don't do much Instagram, but, Facebook quite a bit. But if people want to contact me there, I'm happy to answer any questions or help you find chiropractors in your area, because there's lots of different chiropractors and we all practice little, actually quite differently from each other, but all the different ways can be very helpful. And my last little blip I wanted to quick throw in, if you don't mind, is that one of the things I so enjoyed in Tony Robbins seminars is that on the last day, on Health Day, he always said, everybody should see a chiropractor on a regular basis for a properly functioning nervous system. And I always heard all the chiropractors in the crowd cheering because there's plenty of them always there. But I know that he always has taken care of himself with chiropractic care as well. So that comes from the big man himself.
I love it. Jason?
Yeah, I just wanted to add to Dr. Brin, just to kind of talk about my experience as a patient of yours. Is, it's more than just a practice; it's a family. You go in there and you're greeted as if you're a family member, and they know so much about you personally. And my favorite part of the whole thing is not just the adjustment, but the nice hug that I get at the end, just for being there and taking good care of myself. So it's a very intimate type of experience, I think, that you have than maybe in typical medical settings, that you kind of rushed through an appointment with a doctor, and you don't get a lot of time for feedback. It's really warm and intimate, and it's fun. It's a beautiful place to be.
Thank you.
And how do people get a hold of you, Jason? I mean, I know you're an amazing coach. So how do people get a
Yeah.
hold of you?
So you can get a hold of me a couple of ways. I'm on Facebook as Kimura Coaching. You could also find me on Instagram under my name, Jason Kimura, Kamora. I do coaching both in the Poconos and online. So I have patients from all over the place. I'm waiting for one to come out, for my first client to be international. I'm excited about that opportunity, but I've got some leads there, but you could certainly reach out to me that way. I'd love to be able to connect with you and just see how I can kind of help improve your overall well-being.
And here's the truth: everybody needs a coach, and everybody needs a chiropractor. I mean, there's no better way
Absolutely.
to begin to optimize. And I love what you said, Jason, about Dr. Bryn, because the part that makes it personal, the part that makes it authentic, the part that is tapping into from heart to heart, is an absolutely essential part in everybody's healing. And as my platform, which is called the Doctor's Guide, it's all about curating, educating, and guiding my customers, my colleagues out there. How is it that we can embrace all the elements that will make the absolute difference? There is no magic pill, there is no magical surgery. It's really about being proactive, as Dr. Bryn was saying earlier, getting ahead of the game, or being in the game even before it becomes even an inkling of a problem. And that's the best way to do things. And I remember, I started coaching, and I'm also a peak performance coach, by the way. But I started coaching, many, many years ago, and then there was a hiatus, and then I look back, and everything stalled. It's like everything went slow. And so I get
True.
coached at least, actually more than twice a month. I invest a lot of money in coaching. It's such an important part. I'm investing a lot of money in structural adjustments. Got my adjustment yesterday. It was amazing. And so as listeners, I hope that you're learning, the importance of these kinds of things, and reach out to my guests so that you can begin to navigate with some guidance, your own health journey. And it's never too late, but the best thing is start as early as you can. So thank you so much, both you and both Jason and Bryn, Dr. Bryn. I'm Dr. Bart Rademaker. This is the Doctor's Guide podcast, raw and unfiltered, and we will be back.